Howdy folks, I'm here with Janelle Zabrick, who's a physical therapy specialist extraordinaire, and she has earned her degrees in physical therapy as well as her doctorate in physical therapy from Concordia University. Thus she has her DPT, OCS, as well as a number of other postnomial. So many I can't even remember them off the top of my head. But she is a specialist in orthopedics, particularly sports medicine as well. So it's excellent to have you here because we certainly have a number of patients who have pain, regardless of whether it's from a sports injury or not. She can certainly take care of that. My name is Ramesh Singa. I'm a pain physician, specifically interventionalist at Repulse Spine Pain here in Austin, Texas. And we wanted to go through a few questions because you are the expert in physical therapy, and oftentimes patients come to us and they don't want to go to physical therapy, or they don't perhaps use it to the best of their ability. And so we want to perform a service to the public and community in order to educate them about how important it is. Oftentimes patients come and they're concerned about being referred. They want to know, how often do I have to go to physical therapy, and what's the expectation for exercise at home, daily or not at all?
Yeah, this is a great question. Most patients come to therapy and start by coming 2 to 3 times a week on average. That doesn't mean that they spend their whole course of care at that frequency. As they get better, oftentimes we do wean down to give them a little bit more independence and kind of work on tethering off of the PT and making sure that they're independent in being able to maintain their gains that they've seen in PT. That being said, when people come here twice a week, that leaves 5 days a week of them needing to do something on their own to help maintain the improvement and the progress that they've seen between sessions. And that's where the home program is so important and so effective. The program is specifically tailored to the person and what they're presenting with. And it's not anything ever that's like, this is going to take you 2 hours to do every day. It's usually something fairly simple. It's usually 10 or 15 minutes. It doesn't take a lot of time. The goal is usually once a day to get it done. There may be other things that are easy to do. That's part of the program that might be done more frequently, but only takes like a minute to do, and just doing it more frequently to help. So there is a little bit of a commitment from outside, but what we find is the people that really participate and take to heart their home program actually get better faster and are able to maintain it a little bit better than the patients that come in and just come to the therapy and then don't do anything at home. It's a little bit slower recovery at times.
Okay. And do you ever follow up with a patient, say 2 or 3 months out, and say, are you still doing your physical therapy exercise programs, or is it kind of up to them to make sure they're on top of it?
So again, that's a fair question. There's always the chance that patients can kind of drop off and not be continuing with their home program. We do at times, depending on the patient, set up like a follow-up visit. Like if they're not quite sure, they're ready for discharge, or they're not quite confident, sometimes we'll set a follow-up like, hey, let's schedule you back in 3 weeks or a month and just do a check-in and make sure everything's okay. So we'll do that. Everybody that comes as well gets our email addresses, and we tell them, email us, let us know if you have any questions, let us know how it's going. So we can kind of give them advice too, if they're not sure about something or need a little bit more guidance. We're always here as a resource for our patients.
Okay, excellent.